My name is Dr. Nena Ezigwe. I'm the National Coordinator of the National Malaria Elimination Program. The very latest efforts we have made now is the development of a new strategy that will take us from 2014 to 2016. And the goal, ultimate goal of that strategy is for a malaria-free Nigeria. Yeah, but the target for 2020 is to get us to pre-elimination and place us on a path to, full elimination. So that is the latest step we've taken, and enshrined in this strategy is a number of interventions that will help us to realize our goal. And that runs from the use of long-lasting insecticidal nets, environmental management, including IRS, and the focus on pregnant women, use of intermittent preventive treatment in pregnancy, and also prompt diagnosis and treatment of malaria cases, amongst others. The private sector has critical roles to play because across all these interventions that I've mentioned, there are huge gaps in terms of the commodities, in terms of capacity building of both the personnel and the system. And we believe that the private sector can partner with us. And one area that I can single out to state categorically that we need the private sector for it to work is the area of indoor residual spraying. And this is a strategy that we know that works, and it is a strategy that has not really been taken to scale in Nigeria, and it has a huge cost attached to it. The cost is so huge that governments at this point in time cannot take it up alone. And so we want to partner with private sector to see how we can, work with them as business people, and while maintaining standard, technical standard within the program. The forum is a very welcome development for us at National Malaria Elimination Program. And we also had it last year. Actually, the debut was last year in Abuja, and it was also successful. I mean, they're coming at the very right time. Now that we are looking at elimination, we are happy that they're trying to galvanize the private sector, which is an area that we really want to get on board at this particular moment in the fight. So we are very pleased that CAMA has come up with this technical forum, which they have made, established to be on an annual basis. And I think it can only move us faster in the path that we have already chosen to move.
Vestergaard is the #1 globally in providing mosquito nets, which are long-lasting, factory-treated for control of malaria. It's also one of the leaders in innovation for tools that are meant to provide solutions for challenges, especially in the field of malaria control, targeting insecticide resistance. Technology has really helped a lot because we all started from retreated nets where mosquito nets were provided separately with the chemicals, and the populations were asked to retreat themselves. And there was very little compliance because not only of lack of knowledge to be able to do that, but also because it was time consuming. So our organization was the first amongst the first 2, 3 or 5 organizations to actually invent the factory treated net, which improved quite a lot of compliance because people in rural areas did not need to involve themselves in treating nets, but just to learn how to hang the nets correctly and be able to ensure that while they are asleep, they are protected from mosquitoes biting them and therefore malaria transmission. So my organization over time has not only worked in generating innovative methods of improving the quality of nets and effectiveness, but also working with partners, especially in various sub-Saharan countries, the national malaria control programs, the Ministry of Health, the private sector, and other collaborators including donors, and more so when GBC Health came into being, there has been a lot of coalitions of various partners that enabled enabled a platform for us to be able to showcase the importance of not only production of nets but also usage. My organization has also been one of the strongest organizations in injecting a lot of financing in production of nets. We started with less than 100,000 mosquito nets in production, but we managed to scale up such that by the year 2010, we actually had 7 million monthly capacity of production of these nets that, with logistics and funding from support donors, managed to reach a lot of countries in sub-Saharan Africa. I would like to say that this is the backbone of malaria control in terms of partnerships. One, if you recall back the first starting of what we call rollback malaria, it was actually a partnership platform that brought together the national malaria control programs, the private sector, the multilateral donors, the research institutions. And this was with the aim of ensuring that the call for rolling back malaria was achieved, and of course the global malaria program targets and goals as per the Millennium Development Goals. In terms of what I see as a benefit of partnership, for example, in what GPC Health and CAMA is doing, is that there for a long time existed a disconnect between the public systems and the private systems, and everybody was doing everything by themselves individually in pockets, which led to inefficiency, which led to huge wastage of resources. But partnership and coming together has brought into place increased efficiency in not only utilization of resources, but harmonizing what everyone is doing and avoid duplication. So for me, this is quite a correct step in the right direction that will ensure our targets and goals are achieved, especially the ambitious goal that Nigeria as a country, through the National Malaria Elimination Program, has set to make a road towards elimination in 2020. This cannot be achieved if all partners in Nigeria are not working together in one platform. Of course, everything that is good has its own challenges. What I envision as challenges, which I don't think there are no solutions, is the fact that the bringing together of partners requires funding. So I know it's a challenge, but it's not a challenge that's difficult to really solve. So I hope in this meeting, the outcome would also look at how do we harness funding to continuously have such platforms where partners come together. How do we harness funding to fill the gaps that our support in the donor community have? One last challenge, of course, is that after the call for African continents to contribute 15% of their GDP towards malaria, today there is no country at the moment that does that except, I think, Botswana. So I think one challenge also is how do we change the mindset of African states towards knowing that they have to contribute to the partnerships that exist in terms of malaria control and achievement of their set targets and the global ones.
I think throughout the sessions yesterday, we've heard a lot about how big the problem is and the sorts of gaps that exist, right? So malaria continues to be a significant health and economic challenge in Nigeria, right? It represents about 20-25% of the Africa caseload. In terms of health indices, contributes 11% to maternal mortality, 30% to undefined mortality. So we know the problems. In addition, we know that it continues to have an economic drag for our society, right? So $1.1 billion lost every year as a result of malaria-related absenteeism, which is the #1 cause of absenteeism in the country, right? So in a sense, there's an inherent interest of the private sector to play a role in creating that paradigm shift for the health sector to go from an economic drag to be the net contributor of economic growth and wealth creation?
My name is François Desbrand. I'm working in Sanofi, a corporate organization, and Sanofi is member of the GBC Health. Sanofi is a pharmaceutical company, and as part of our corporate social responsibility, we commit to partner with all stakeholders to fight against malaria, but also all other very important diseases like tuberculosis, sleeping sickness, tropical neglected diseases, and so on. As a pharmaceutical company, Sanofi commits to continue efforts in research and development to bring innovative new products, because as I told you a few minutes ago, there are resistance already coming in the Mekong region, and it will probably flood into Africa in the coming years. So we have to hurry to find new mechanisms to fight against malaria, like coming with new drugs. So our main challenge, I mean globally, is to bring new therapeutic means to fight against malaria. But also, at the same time, we have to commit bringing the existing ACTs at the lowest price as possible to expand their use and proper use. We should also work on awareness for the population and training tools for the medical doctors, for example, for proper use of these medicines, because quality is key to fight against resistance, and proper use is also key to fight against resistance. First of all, it has been underlined at the very beginning of the forum, there were tremendous results which have been delivered by the stakeholders for the last 15 years. So it is very possible and very achievable to get. We are starting talking about elimination, which was just a dream 15 years ago. So now it's becoming possible because of the partnerships. So I'm very confident in the way GBC Health and other stakeholders are doing together, fighting against malaria to eliminate malaria in Africa and in all the world. And I would say that this is probably the only way to achieve this tremendous stake, because nobody can do it alone. We should work in partnerships, for sure.
My name is Baba Funke Fagbemi. I'm the Executive Director for Center for Communication Programs Nigeria, and also the Executive Producer for Newman Street.
As I welcome our person, feel lucky today.
Newman Street is an entertainment education TV drama series put together in collaboration with Nollywood. You know, Nollywood is the vibrant, robust entertainment industry in Nigeria and in Africa, and it seeks to entertain and educate the audience on things that we encounter in our daily lives, and also on thematic health issues where we need to build our level of consciousness and our responsibility and skills to address them. So things like malaria and family planning. Currently, those are the current issues that Newman Street address. Most of the barriers that community members face in being able to uptake some of these services that a lot of donors and private sector are investing in are actually obstacled by demand-side issues. So demand-side issues being sociocultural issues, lack of correct information, not having peer support or social support, or feeling like the myths and misconceptions are actually things that will prevent them from using some of these commodities or taking some of these behaviors. So these demand-side issues must be addressed. And we have learned that didactic methods of teaching and preaching to the audience has not worked, which is why we are leveraging on entertainment education. The biggest success is getting people to catch on to the vision, and the fact that Newman Street is gradually gaining popularity. People love it because of the A-list characters we are working with. We have celebrities on set, we have celebrities on the show, Bimbo Akitola, Sani Mwazu, Freda Mata, Righteous Man Yorabo. We even have Two-Face as part of the characters on Newman Street. So apart from the A-list characters, we also have aspiring artists who are up and coming, and the audience really love them. So a success for Newman Street, a huge success, and the slogan for Newman Street is "Life as it is that it is extremely believable." I think if partners who are privileged to be on board this platform are able to organize themselves, coordinate their efforts and investments, you will see the results dramatically. So for instance, a lot of us are attending this forum because it's an opportunity to meet the private sector that we've been dying to have a relationship with. And interfacing with them, we say that they're really interested in investing in initiatives like ours, but it's the opportunity to meet them that really doesn't come readily available on a daily basis. So CAMA is starting in Nigeria, and I hope that they are here to stay for a long time, because it's an opportunity to bring together all these players and make sure that what they're doing is delivering huge results. Everybody wants to measure performance, and with the private sector, we can move that a long way.
Alhaji Aliko Dangote is the Malaria Ambassador for Nigeria, and as such, we have an extra responsibility in this particular space. What we've been doing so far has been a lot of the more classical interventions that the foundations or charities or philanthropies have been doing to fight malaria, which is funding NGOs to do bednet campaigns. We've supported the Clinton Health Initiative. We give the money to pilot a SMC, a seasonal chemo prevention program for malaria in 6 states in the Sahelian north of Nigeria. And so we've been doing those kinds of things and supporting the National Malaria Elimination Program with funding, with support, with ads, and just using our voice and Alhaji Aliko's voice to really shine a light on the fight against malaria. Alhaji Aliko Dangote has also founded and funded PSHAN, the Private Sector Health Initiative for Nigeria, which is really a coalition of private sector companies that have come together to bring their contribution to health issues here in Nigeria. One of their areas of intervention is malaria. So part of their job is to mobilize the private sector to find areas of innovation that private sector companies can invest in to actually get a return in this fight against malaria.
The financial sector of the economy is well positioned to support in programs like this, social development programs like this, elimination of malaria in Nigeria. We also said that worldwide it's known that financial sector is critical to any social or economic development of any country. And so because the banks are positioned and other financial institutions are positioned for such, they are close to both the private and the government institutions. Close to them in the sense that all financial relationship of all those two areas of the economy report into us. And so we have a good view of what the private sector and the ability and the capacity, and then their readiness to support programs like malaria elimination. And so we feel that because of the platform we already have in place, we can also co-opt them on that same platform and let them leverage on that to support in malaria elimination program for Nigeria.
I can see a malaria-free Nigeria because I believe in precedents, first of all. Some countries have actually eliminated malaria. So that is a precedent that has been set. Secondly, we know how malaria is, we know what causes malaria, how it's transmitted, and there are interventions, to really tackle the whole process of malaria in place, and they're working. So all we need now is for everybody to, first of all, also believe in that, to believe in a malaria-free Nigeria, and also to do their part, because everybody has a role to play, as individuals, as families, as communities, as a country, with the collaboration of everybody, especially the private sector at this moment. I think we'll have a malaria-free Nigeria.
It is the aspiration of everyone, and I know it is possible to have a malaria-free Nigeria. Malaria is not possible to be tackled by a single entity. It is a disease that requires everybody to do something. while at the same time, all of us together pulling in the right direction. The role of CAMA, and I think they have, as an organization putting together private sector in malaria initiatives and alliance, they have brought us this far. I have attended more than 3 sessions, and every time I see that we are progressing positively. So it is one organization that I would really call upon partners to really support this initiative and ensure that we continue to sustain its achievements and also progress in especially for Nigeria as a country.
I think eventually Nigeria will get to a malaria-free country, and however, we still have some issues that we need to address. And government is doing a lot, private sector is doing so much more, and donors are also investing hugely. But until we get to that point where the community members themselves, they see the need and why they should make this a priority, and they're able to take that conscious decision to do something. So for instance, what does it take to sleep under the net? We need to own a net first. So as long as we're able to work together, address issues of access, most of which are on the supply side, improve health facilities, improve the skills of health providers, and also, as I said, work with innovative, creative models and address demand-side issues, gradually we shall see a malaria-free Nigeria. But we're not talking next year. It's a long journey.
I think it's possible. I mean, I'm reading a book now on how Italy defeated malaria. Now, the challenge is that it takes many efforts from different people. You need the public sector, obviously, you need the private sector, you need the medical community, you need the grassroots level community. So really what it takes, what we have today in Nigeria is, as we heard in the session that I was just in now, is how fragmented the different efforts are. So we don't have a platform that brings everybody's efforts together. I think that's the #1 obstacle. The day that we can get government, private sector, not-for-profit sector to be rowing in the same direction against malaria, I think we can definitely aspire to a malaria-free Nigeria. But it takes the effort of everybody putting their eggs in this particular basket and rowing in the same direction. Right now, we also heard a couple of days ago about different interventions from the private sector that are not captured by the National Malaria Elimination Program because they don't even know that this is happening. So this is money, resources, innovations, technology that the program that Nigeria has to fight malaria is not even aware of. So I think there's definitely a need to bring it all together. We've commissioned a report on how the private sector can play a role in the fight against malaria. We now need to disseminate this report and agree with everybody else in the private sector that's concerted that these are the steps that the private sector should engage in. So I do think we can aspire to a malaria-free Nigeria, but it requires everybody bringing their contribution in a concerted way.
Do I see malaria-free Nigeria? Yeah, one of the things I said to at the session was that every step taken towards financial inclusion, which Nigeria is strongly into today based on the MDG goal of 2020. Every step towards financial inclusion is a step towards social inclusion. What that means is everything that we have put in place, the resources, the technology, the people that we have put in place for financial inclusion can also be leveraged upon by private sector to reach all these communities that we. And so if you say, do I see a malaria-free Nigeria, I would say as much as I can see a financial inclusive Nigeria, I can see also a malaria-free Nigeria.
I think the way of the future is to really look at how we come up with commercially viable investments in a space that hasn't been normally looked at in a commercially relevant way. I think the idea of a health bond or a malaria bond specifically is excellent because it brings to bear the rigor of the private sector, the requirement of results, because you have to produce something, you have to pay this back, you have to manage it like an actual investment. I think that's the way to really go. This is how we're going to be able to get more of our own investments in the solutions for the fight against malaria, meaning the drugs themselves, the rapid diagnostic tests, the bed nets, all the things that are right now being imported from other places that we can actually produce right here. I'm specifically talking about Nigeria, that we can produce right here. But these things are doable if the environment is sorted out and organized, and if a mechanism like a bond or an impact investment vehicle is put in place, I'm sure that the interest of the private sector will be piqued, and the funds that will be allocated to those different instruments would be a lot more than the charitable contributions and checks that the private sector is able to write.